Hello and welcome to Business Talks. I am your host, Lana Smith, and I am so glad that you've joined us today. We're going to take you into a different dimension in the medical world, hyperbaric treatment. And some of you have heard about this. A lot of people know it because of scuba diving. So if you get the bends, you hear you have to go into a hyperbaric chamber. But as far as using hyperbaric therapy for a variety of reasons, it is an amazing option for those people who are looking for something to fix, traumatic brain injury, open wounds, just to oxygenate your blood and to live healthier. And the hyperbaric treatment it's fascinating. And I have the amazing Dr. Karen Stanek on today, and she is the director of the Spokane Hyperbaric Center in Spokane Valley. And thank you for coming on today to talk about this.
Well, thank you, Lana.
Yeah, we've been talking about it for probably over a year, and I've learned so much more about it. And I'll tell the audience, I actually was able to experience it yesterday. They got me in so I could see it firsthand. All I have to say is unbelievable. It was nothing that I expected. So you have been in the medical field since I'm not going to age you. I'm going to let you do that. So you started your medical career when?
Well, I finished medical school in 1988.
Okay.
Finished residency in physical medicine and rehab in 1992.
Okay.
And then moved to Spokane after doing a year of locum tenens, which is kind of a traveling doctors association type thing, for a year. And then became medical director of Deaconess Rehab Institute at that time in 93.
Okay. And you were at St. Luke's for...
Well, I helped form St. Luke's.
Oh, you did?
Deaconess Rehab merged
Okay.
with Sacred Heart Rehab
Okay.
to form St. Luke's.
I didn't know that.
Yeah.
Okay.
Yep.
And so you were part of that.
Right.
And then in 1996, you opened your own practice,
Correct.
Northwest Medical Rehab.
Yep.
Why did you move into private practice?
Mm-hmm.
Did you see a need for your specialty?
There definitely was a need for my specialty, and what was happening up at St. Luke's is that new ideas, because it's a big organization, would take a long time to get new ideas on board. Mm-hmm. And I wanted to do it faster.
Okay.
I wanted things to turn so that I could be the first one out there doing it instead of the fifth or the sixth one doing it.
And then you got involved with the Hyperbaric Center. Tell us about that. How did that marriage come together?
Well, it's kind of a funny story in the fact that I did not know the owner, who is Al Grafoni out of Seattle. He was an entrepreneur along with Dave, who since has passed away. But they had a vision of establishing a step-down traumatic brain injury unit.
Okay.
And because that is my subspecialty, is traumatic brain injury, they asked me to be part of this. And so we were going to build a facility where the patients would have their own rooms, but with a center that everybody would be able to come together and have classes and have meetings, but they would have their own rooms. Mm-hmm. They would have we would have a group kitchen where we could teach the traumatic brain injured children or adults, depending upon where they were, and what stage they were at, how to progress beyond their injury.
So occupational therapy.
Occupational therapy,
Yes, okay.
physical therapy, and a big piece of that, which was the new piece, was hyperbaric oxygen.
Okay. So what created that passion in you to follow this? You must have saw the need. I mean, working with TBIs.
Right. I guess it started basically during my residency training.
Okay.
We get to do different 3-month rotation, if you will.
Okay.
You know, either in certain areas like spinal cord or traumatic brain injury or psychology or whatever. And traumatic brain injury really just had a passion. And when I was a senior in residency, believe it or not, at that time, we were not having to pay back our student loans. But when we became seniors, of course, the rules changed, and they said, well, yeah, you have to start paying them back now. And so we all had to go out and find jobs, right?
Oh, yes.
And I happened to go to the university, I mean, to the, it's kind of like the Lakeland Village, if you will, of Colorado.
Okay.
Because that's where I was doing my residency. And I saw the tone and the tightness and the pretzel-like positions of so many of those children in that facility. I just said, there has to be something better.
Okay. So now, 2006, the Hyperbaric Center opens,
Yep.
and you are now director of this business. And tell me about. Let's talk about hyperbaric, the treatment aspect of it. So, and in layman's terms, because we can't digest all of it. You had many years of training and experience. So tell us the benefits and why.
Hyperbaric, the definition of hyperbarics is breathing 100% oxygen under increased pressure. And so as we go up into space, the pressure, of course, gets less. As we scuba dive, go down toward the center of the Earth, the pressure gets more. So oftentimes we call people who are getting hyperbaric treatments divers.
Yes.
Okay, so it's kind of your nickname now that you're a diver.
I'm a
okay?
diver. Okay.
When we breathe room air, which is 21% oxygen, at 1 atmosphere of pressure, which is sea level, okay, our hemoglobin molecule, where the oxygen attaches, is 21%, room air is 21% oxygen. The hemoglobin molecule is already 95% saturated. But under hyperbaric conditions, it goes up to 100. And you go, wow, 6%, how does that make any difference at all? It doesn't. What happens is, because of the pressure, the amount of oxygen that is dissolved in the plasma of the blood goes from 2% to 100%.
Okay.
So now you have a very high concentration of oxygen in the blood. Things always flow from a high concentration to a low concentration, and it leaves the blood and goes out into the tissues, and it is the extra oxygen in the tissues that allows the body to heal itself.
Okay. So when you're looking at this as a potential therapy for somebody, tell me some conditions that really benefit from the hyperbaric treatment.
Do you want those covered by insurance or those not covered by insurance?
Well, let's start with covered by insurance, because I did hear that yesterday from some of the participants
Right.
about insurance coverage.
Right. And there are a few of them that are covered by insurance. There should be many more, and if you lived in Russia, you could have 60 of them covered by insurance, but we don't.
Yes.
So there are only 15 conditions in the United States that are covered by insurance.
Okay.
One of them is the bends.
Okay.
We don't see too many bends around here. We're kind of landlocked.
Yes.
Okay. One of them is necrotizing fasciitis, which is flesh-eating bacteria.
Okay.
Gangrene is covered. And acute trauma, where you might lose a limb if you don't get blood supply to that area. That is covered. Carbon monoxide poisoning.
Okay. A friend of mine asked me about that. Okay. If that was one of the conditions, and I said I did not know. So, okay.
Yep, that one is covered. And probably the one that we see the most of out at Spokane Hyperbarics is if you have had radiation damage because of cancer treatment, especially to the gums, and the teeth are starting to fall out, the dentist will not remove the teeth or do an implant until they have received 20 hyperbarics before
Okay.
and 10 hyperbarics after, because they say it's not going to take unless we get blood supply to that area. And hyperbarics helps with angiogenesis, which is the formation of more red blood vessels.
Okay.
And so as we improve the vessels, we're going to improve the blood supply.
Okay. So, and then, so cerebral palsy, is that covered? Because
No.
there was a gentleman there who had CP, and yeah, so that there was there were a couple of different. I know pressure ulcers,
Yep.
depending if you're diabetic or not diabetic, is
Right.
covered.
So some of the wounds are covered, and you were right, Lana. If they're diabetic with a grade 3 pressure sore,
Okay.
which means it has to be deep into the muscle, and you have failed 6 months of conservative therapy, then they may consider paying for the wound.
Okay.
Okay. Any other wound is not covered. You have to be a diabetic. So just a simple pressure wound is not covered. We do see a tremendous amount of benefit for patients who have suffered from stroke, from head injury, from cerebral palsy. We see a big improvement in anybody who has had a hypoxic or an anoxic injury, like a choking accident or a near drowning accident, anything like that, where the brain, if you will,
So
has been deprived.
asphyxiation type
Yep.
situation. Okay.
Becomes ischemic or not enough oxygen, those people do very well.
Really?
Yes.
Okay. Okay, I'm sorry, I'm processing this. I know of a young lady who had a suicide attempt and was unresponsive for over 2 hours and has a stroke-like brain injury because of the lack of oxygen to her brain.
Yes.
Now, would she be somebody that could benefit
Yes.
from the hyperbarics?
Absolutely. And people
Okay.
say, well, yeah, but it's been 2 years or it's been 4 years. Of course, the sooner you can get them in a hyperbaric chamber and get that oxygen to the brain, the better.
Yeah.
But it works even 7, 8 years afterwards.
Okay.
You still get some improvement. And again, what I have to say is that hyperbaric oxygen is not a cure. It helps the body heal itself. So it makes you feel better if you are already healthy and don't have a chronic disease of any sort. It's good for those down days that you have. But even if you've had a stroke 7 years ago, you can still benefit from it. I had one patient that had been 8 years out from his stroke, and his walking was jolted, and he couldn't speak. And we indicated to him, what do you want to get back from the hyperbarics? And he goes, I want to walk. Guess what? He got his speech back.
Be careful which one you ask for.
So we cannot
Yeah.
predict which part of the brain is going to take the extra oxygen and heal. We don't know
But
that
his
yet.
did, I mean,
But
the
his did.
communication, the verbal.
Right.
Wow.
And that was 8 years post-stroke.
What else? So give me a couple of other examples like that where you've seen people, that their bodies have healed from.
We've had a 5-year-old that they did not think was going to be able to go to school because of autism. And again, it's not just the hyperbaric, but he also had extra therapy. He had detoxing. He had many other things happening at the same time. But after 80 treatments, he is mainstream second grade.
Really? That is so exciting. And yet you're saying the insurance companies have not gotten on board. Why, can I ask what you feel like their perspective is, why they don't? Is it because it's a non-traditional therapy?
That's one of the reasons. It's a non-traditional therapy.
Okay.
Number 2, it's difficult to make a lot of money off of it because how do you patent oxygen?
So you just have to, you patent the
The
way
cha-
it's,
the
yeah,
chamber
the chamber,
and the way
okay.
it's delivered. But, it's not like a drug
Yeah.
where you do the research. The other problem is they say you haven't done double-blind, placebo-controlled trials. Well, that is very easy to do if you have a pill, because you either give this group over here the medications and this group not. But in a hyperbaric chamber, people can tell when they're pressurized, even though they're breathing room air. So how do you do that double blind?
Yeah, this is true. Okay. It seems like such a simple, non-invasive treatment for people that has some extraordinary benefits, and yet here we fight to be able to have, with insurance, the potential to get that treatment.
If there would be anything in the next few years that would really make a difference, because so many people are kind of getting fed up with insurances,
Yes.
that, people say, well, I'll just pay for it. And many people feel that hyperbaric oxygen is very expensive, and it depends upon where you go for it. If you do it in a hospital, they are charging the insurance companies about $1,500 a treatment. But if you find a private chamber where they can do both off-label and on-label, basically, on-label being ones that are paid for by insurance, off-label being ones that are not, we're only charging private pay $140 a treatment.
Which for the treatment, makes sense. It just does. I had the opportunity to go yesterday because I've seen a hyperbaric chamber in a hospital in Cozumel, Mexico.
Okay.
Because I'm a scuba diver, and one of the people I was with on a scuba diving trip ended up in the hospital from neurological embolism, or the bends in his head. And so I got to witness one in a hospital, and it was crazy. But so that was my frame of reference. And when you go into Spokane hyperbarics, it's different. It's what I enjoyed. So there's 6 seats. We've got some pictures. I think we've shown some pictures. 6 seats. So it's almost like going on an airplane with 5 of your friends. There you go. There's a picture. And you go in, you sit down, you get measured for your, is it a cuff?
Hood. It's a
hood.
hood.
And it's a plastic piece that goes over your head with a rubber stopper. I'm
Latex.
Thank you. I'm using my own medical terms here. And then you sit there. It's almost like you become a spaceman. They hook up the 2 tubes, and then the tubes into the collar. You can see that they're showing pictures. You can see that, and then those tubes are hooked in, and then you get a clear plastic hood or space. I call it a space helmet, which connects to the hood, right?
To the ring, yep.
Yep, to the ring, and then that's it. But then the latex seals so that you're getting all the oxygen, right, just into where you're breathing. And then you sit in, it was a 90-minute, so you go in 15 minutes, you dive down, right? That's where
You pressurize.
you pressurize. So if you're a scuba diver,
It's like going down.
Yeah, when you're going down. So you're clearing your ears, just like it went on an airplane.
Yep.
You're clearing your ears. They have gum, they have water, they have everything you need to help you clear your ears. Since I dive, I can clear my ears. And then 15 minutes, and then they put the hood on, or your space mask on, and then you're in for an hour for 60 minutes of the oxygen. So you're breathing 100% oxygen for 60 minutes. And during that time, you can read a book, a magazine. They put a movie on, which I thought was really incredible, because the screen is in a portal, so you feel like you're in a submarine. But the movie screen is actually on the outside of the window, so they have the speakers. It's amazing. And you can talk while you're going through treatment. We were having conversations. And then after 60 minutes, you take your hood off and disconnect, and then 15 minutes of what we're surfacing then, right? Coming back.
That's right.
So can you explain that process?
Yes. What Lana experienced when she was down with a scuba diver friend was probably a mono chamber, where you had one person in a tank. It's kind of a cylindrical tank. They seal them at the end. They're laying down on their back.
It looks like a submarine. I mean,
But it's just single.
Yes,
It's just
a
kind
single-
of, almost looks like an
yes.
MRI, kind of.
yes, yes.
And a lot of people don't like to do MRIs, okay? They get anxious.
Claustrophobic.
Yeah, claustrophobic and anxious. What Lana experienced yesterday was what is called a multi-chamber treatment. Multi meaning many. We do have 6 seats lined up on one side of it. We did have 6 seats on the other side so that we were able to treat 12 people at once. But we took out 6 seats so that we could go ahead and get in wheelchairs or gurneys
Yes.
for people that can't move to a chair. Why do we have to wear the hoods in a multi-chamber when you don't in a mono-chamber? The biggest reason is the size. The size of a monochamber is pretty small. You can pressurize that much oxygen without a problem. The size of a multi-chamber that holds 10 to 12 people looks like a little mini submarine. If we were to pressurize that much oxygen and there was a spark,
Oh,
you would have a little explosion.
it would be 4th of July, unintentionally. Yeah.
Yes, in fact, that's what happened with one of the Apollos that blew up in the sky.
Okay.
So pressurized oxygen and any type of spark is dangerous. So first, do no harm. So we have to pressurize room air. Pressurized room air is very safe. You have it in your car tires, bicycle tires, basketballs, whatever. We pressurize room air, but in order to get that 100% oxygen under pressure, you have to wear the space helmet.
Gotcha. It makes complete sense.
Yep.
And so when we dove down the first 15 minutes, it was pressurizing.
Yes.
And that's where we have to clear our ears.
Yes.
And that means when you pressurize in the chamber, how far down, like if I was scuba diving, what would what the equivalent would be to how
Very
many?
good question, because different medical conditions require different pressures.
Okay.
Okay, so if I'm treating a brain injury, if I'm treating something pretty fragile, like nervous system, I only want to dive them at 1.5 atmospheres, and that's the same as if you're scuba diving about 15 feet underwater.
Okay.
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 Yesterday, you were in the 4:30 dive, and yes, we did have one CP kid in there, but he had already done some at the 1.5, and so he was up to the 2 atmospheres.
Okay.
So that would be the same as if you were scuba diving 32 feet underwater.
Okay.
So you feel a little bit more pressure on the ears. What happens if you can't clear?
Yes.
We're down, 5-10 minutes into the dive and you can't pop those ears. What we have to do is we have to stop the dive and bring you back up.
Okay.
Because if we allow that pressure to build up, you run the risk of rupturing an eardrum. And that is one of the side effects of hyperbaric oxygen. So we have to make sure those ears are clear.
Well, and I noticed, there's cameras in the chamber. You have a staff member that actually goes on the dive with you. So there's you always have somebody there monitoring.
Yes.
Which I would think you would need to.
Yes.
There was a gentleman there in a wheelchair. I think there was a pressure wound, and another man, an amputee, who also had a wound. It was for wound care.
Yes.
That he was telling me about. And that was, so I was fascinated by just the different people that were in my group. And it's lovely. And I was talking to Adam, one of the staff there, and asking, because they all usually are scheduled the same time. It seems like they all come in as a group. So they get to know each other. Like they come in, it's like a coffee group.
Exactly.
They're asking how they're doing, how their kids are, which I thought that was wonderful because, it's an experience and it's a shared experience. And so you're all there together. And I thought the camaraderie was really, it was quite sweet and wonderful. It didn't feel awkward at all sitting in that chamber for 90 minutes with those people because you've already talked, you've gotten to know. It was just really nice.
We have had unique relationships develop from things in the chamber. We had one little kid that was autistic, and he did not like to be touched or handled at all. And we had an elderly gentleman, I'm not sure, he might have been in for Parkinson's, and he kept talking to this little boy. And by the end of their 20 treatments, the little kid reached out and held his hand.
Oh, no.
So those are just such precious moments,
Yes.
that there's all kinds of healing, basically, if you will, that is happening.
It's not
Yeah.
just physical.
Right.
That's amazing.
Yeah.
Do you have another success story of maybe somebody that doesn't have a chronic illness or an acute situation, but migraines? I'm going to go to migraines. Migraine sufferer. That's how I know her.
Yes.
So with migraines, there's somebody who just has basic aches and pains that we get as we get a little older.
Right, right. It is good for soft tissue. It is good for for migraine headaches. We've had some younger kids, because a lot of the medications are not able to be used in children under 18. And yet some of these children get migraine headaches at 10, 11, 12, and they miss tremendous amounts of school. And we've had them come in and do the hyperbarics, and their headaches have gone away.
Wow.
Now, again,
Yeah.
migraine headaches is a broad topic. There
Sure.
are many, many different things that
Yeah.
can cause migraine
Yeah.
headaches. I'm not saying that hyperbaric will cure all migraines, but in this particular young kid, it did.
That's incredible. And so the benefits as we get older, what are the benefits as we get older for that oxygen saturation?
I have to share this with you because when we first opened, we were looking for ways of advertising, right? Okay. And so we had a mother and a daughter team, and we took a picture of the mother going in and the daughter coming out.
Oh, yes, yes.
And so we basically played a joke that see what hyperbarics can do.
Reduce, yeah, the beauty of youth.
Yes, the
Yes.
beauty of youth. However, that's not necessarily true. But if you're having problems sleeping, and many people do after they get to a certain age, it helps with sleep tremendously. In fact, during the first few treatments that you go for, people go home and want to sleep.
Yes.
But remember,
Yes, they do.
sleep is also healing. So by the time they've completed 20, 40, 60 dives, they are so full of energy, they want to go out and work in the yard, they want to garden, they want to go on those walks, that before they just didn't have the energy to do that.
Well, and it makes sense. You're oxygenating the blood.
Right.
So, I mean, all of that promotes great health.
Right.
Right. I mean, there's no downside to it.
And then from the blood to the tissues. So all the organs that maybe just needed a little boost to work at 100% instead of 90%, it's now working smoother and faster and better. And so that improves the function, if you will, of the whole body.
Isn't that amazing?
It's fascinating.
The other part, so I was going to ask, is on treatments. So when I was asking questions yesterday with Adam and Joy, what is the best benefit for the treatment? So is it doing 20 treatments consistently, or doing spot treatments, once a week, once every 2 weeks? What does that look like? And I'm sure everybody's situation's different.
No.
Oh, no. So, okay.
The more you can do in a row, the better.
And why is that?
If you do it just here and there, it takes a while for the oxygen to build up in the body and
Okay.
supersaturate all those organs. You're not going to have that happen at one time.
Okay.
In fact, I've had people come out and say, well, I just want to try 3, and if I'm not better, I'm not going to do it. And I said, don't waste your money. That's not the way hyperbaric works. It's not like a pill. You have to do it consistently over a period of time. Now, the length of time or the number of dives, or treatments, that is how you determine if it's real severe, the more treatments you're going to need. If you're, wanting to feel better.
Maintenance. Yes.
5, 10 will help. 10 is obviously better than 5.
And then the oxygen saturation, it stays in your body?
Yes, for a prolonged period of time. That varies from person to person.
Okay.
But it can last anywhere from 1 to 6 months before you
Okay.
kind of come back in and want to need a booster.
So interesting. And this is an area that, I mean, so many of us don't have any concept about. It's an amazing therapy. I mean, just going yesterday and having that experience. And, as an alternative, or in combination with,
Yes.
different therapies, that to see the success, more people need to know about this, who are facing, debilitating situations, chronic pain. I mean, you look at the statistics on people who will say they have chronic pain. I mean, it's extensive.
Right.
So situations like that.
It helps fibromyalgia. It
Okay.
helps the muscle knots. It helps tension. Yes, it helps. It helps all that.
And you don't have to take a pill, you don't have to take an injection. You go in and you get to meet great people and watch a movie and come out with this tremendous benefit. I wish more people were marketing, sharing this information.
Well, thank you for having me on, so we can share
I
it.
am
That
so
is-
excited about it. I know that I will be back, and I'm telling you, wouldn't even know how many people I called last night. I won't even say, but because I was so excited about it and hearing the stories from the other people, I was like, why did I not know more about this?
And we have been out there for 15 years,
Been amazing.
It is really, really amazing. And I really think that there is, I'm dreaming into the future, but if the surgeons would buy into this, not necessarily for their run-of-the-mill cases, but for patients who are high risk, if they, like the dentist, would give them 20 treatments before the operation,
Yeah.
I just think that their outcomes would be phenomenal.
The benefit so
Yeah.
far outweighs
Right.
any I can't even see a detriment. But when you look at that, so I'm hoping that people will watch this and then be curious, get more information. So tell me that if people want to get hold of you,
Yes.
and we'll have that information on at the end of the show.
Sure.
But if people want to get hold of you, how do they do that?
Well, it would be best to get a hold of the hyperbaric chamber, and
Okay.
that number is 922-6552.
Okay.
And Joy or Brandy or Adam or Janice, whoever works out there, will be answering the phone.
And you have there's a great website. Your
Yes.
website is very well done where you understand.
SpokaneHyperbarics.com.
Okay. SpokaneHyperbarics.com.
Right.
So if you are facing an illness, a traumatic brain injury, somebody who's had a stroke, hearing problems, I mean, fibromyalgia, it's endless. Get online, go to their website, and I would highly encourage you to talk to your doctor and also do the research, because this is an incredible opportunity for you to be healthy and to take control and to have it be non-invasive, non-medication status, that you can start helping, to oxygenate your blood. I will get that, and just help for so many health benefits. So thank you so much.
So I
for
would like to
sharing.
make an offer.
Yes.
And that is if anybody calls over the next 2 weeks
Okay.
and says that they heard about it on Business Talks, they'll get an additional 10% off.
Oh my gosh. Do I get to use that discount?
Sure.
I will be calling and making more appointments, because last night I felt, I migraines and I felt tired, but it was that fatigue, that it's a good fatigue. You feel like you have done something.
You're relaxed.
Yeah. And I haven't felt that way in a very long time. So thank you. But also, for that soft tissue and any migraine stuff, I'm excited about it. So you can tell, I hope. And you're going to be coming back on in a future show to talk about stem cell replacement.
Yes.
Which is another fascinating medical option.
Advancement.
Thank you, advancement. So be looking for that. We're going to talk about that in anything, take care of your body, and especially in these times.
Absolutely.
Take care of yourself. And again, thank you for coming on. And don't forget to call and get your 10% discount on your hyperbaric treatments. And I have no doubt that you're going to be absolutely pleased with the benefits and what you see as the outcomes. So,
well, thank you so much for having me.
thank you. And Northwest Medical Rehab is where you can find Dr. Stanek. That is her practice, and they do incredible work there. If you have chronic pain or cerebral palsy, all the things we're talking
TBI.
about, strokes, TBI, this is the gal you want to see. So, again, thank you. And I want to thank you for joining us for Business Talks. My name is Lana Smith, and I'm your host.
The world has changed a lot in 50 years, and Kimley Haygood has changed with it. We still provide our customers with the highest level of service, whether it's financing, construction management, property management and maintenance, leasing, or sales. Our team is here to help you make the best decisions with your real estate.